It could be a slip and fall. It could be a workers' comp injury. It could be someone assaults you. All sorts of different ways that it can and does happen. But when it happens, it's severe. I've had them carry people in. I've had people that I've had to go to their homes because they couldn't get out of bed. It's unbelievable, the pain. And when it hits you, it can be the worst pain you've ever had in your life. But the good news is chiropractic and affiliated healthcare can help you and help get rid of the pain. So many times when you get it, people will rush to the doctor, runs to the hospital, and they get an MRI, and they say, oh, you need surgery, it's the only way to fix it, and people get surgery. You don't have to do that. And we all know that surgery is not perfect. But when, if necessary, yes, it is necessary. But it's important to always do conservative things. And that's what we do at Affiliated Healthcare with chiropractic. We do spinal manipulation. We could do it with our hands, or we can do it with instrumentation without the force. It works. It helps you. It helps you get back to your normal life and lifestyle. But when it hits, boy, it's bad. Even I, as a chiropractor, have had it. And I've had it sometimes so severe, they wanted to do surgery. But I said no. I just wait. I get my adjustments. I get my physical therapy. I got myofascial type of massage. All these different things. And it helps to relieve the problem. That's why I love being a chiropractor. People love their chiropractor. Why? Because they get rid of pain. That's what we do as a chiropractor. And that's the most important thing in the world. Because there's nothing worse than pain. You go to get into your car, all of a sudden you get the pain. Or you have the pain, you got to get into your car, you got to sit down, you got to try to go on with your life. And it is so bad. Well, that's how it goes. But we're there to help you. And it's so really easy for us to do it. Sometimes I've had it with a person on 1 or 2 visits, bing, it's gone away. But most time it can take a week to a few weeks to even more. But what is important is to continue with care to make sure that you can get that vertebrae to stay in alignment and to release the pinching of that nerve. We need to do that. Now, today we've got a few people online. Peter Friedman, a couple of others, Rebecca Belzdick. Peter Friedman, your cat is the star. Yes, it is. The cat is my star. It's amazing. Boo Boo's sitting up here on the side listening to us right now, and he wants his attention, and we give him attention. You know, he's one of our cats that we have, and he is a beautiful guy, and he's so perfect. Oh, and I didn't even know Lightning's behind us. Good morning, Lightning. Lightning's our other cat. He's the alpha cat. He runs the house, and he makes sure everything is going well with all the cats. So we do have the combination. It's interesting. Not only do we have spinal manipulation, but you got to understand, before we start, let's start at the beginning. The patient comes in and fills out paperwork. Then the doctor does a consult to go over their pain, a history. Then they do an exam, taking your vitals, doing your ranges of motion, blood pressures, doing all the things we need to do for an examination, your dermatomes, everything. Then he determines what x-rays you need to take. Basically, with sciatica, it's low back x-rays. Usually we take a minimum of 3 x-rays. That's it. AP, lateral, and then a shot of the spine. And that's what we do. Then we do physical therapy. Now, what's beautiful about us is we've got the whole diverse range of physical therapy. There's Boo Boo's tail again. We have ultrasound, we have electrical stimulation, we have hot packs, we have cold packs, we have decompression, we have myofascial, and we also have something called spinal decompression. That's a piece of equipment that puts your body into traction, and it stretches out just minute marks just to help to increase the disc space. And by the way, that can be both done on the neck and the back. Not all chiropractors have it, but we have the best of the best. And our therapists know how to use it, how to put you in, and how to take care of it. It is not painful, it is so easy, and it's so simple to do. But for some people, they say, Doc, the surgeon wanted to do surgery, you did spinal decompression. Doc, you saved my life. I didn't have to get surgery. And you gotta remember, surgery is not perfect. It never is. And when you're doing surgery, you never know what can happen, what could be cut, how it could affect you, how it affects your body. Plus, I don't know about you, but I don't like to be put under anesthesia. We hear too many horror stories. If it's necessary, you do it. If you don't, you don't. It's important to be always conservative. Look at Boo Boo. Boo Boo's coming in today. He really wants to be a part of the act. Look at him, Boo Boo. It's amazing. He's never been a star coming on like this before, but he wants the attention. Turn around the other way, Boo Boo. Look at him. See how beautiful Boo Boo is? The colors, and he's such a strong cat. Boo Boo, come on, move away. Thank you. So that's why it's important. It's always important to be conservative. Also, if someone prefers it, we do have physical therapists. So we're there with a physical therapist and their assistants to take care of people. We have the option. Also, too, we have an orthopedist. He usually takes care of extremities. He's board certified. He also does our shoulders, our knees, our ankles. We have a neurologist who does neurological consults and reviews those with our patients. We also have therapists who do our therapies and those types of things. And on top of it, we have a physiatrist. That's physical and rehab medicine. And he deals with injections, epidurals, facets, which are shots using things to help relieve the pressure and the pain. And then he does something called a rhizotomy. If the surgery doesn't work, the pain management doesn't work, and people want to see what they can do, we use a rhizotomy. A rhizotomy burns the nerve root. It's simple, it's easy, it's there. It's only good for a limited amount of time, usually a year and a half, but some people, it helps them more than that. But we have all these options, and it's there to help you. And remember, affiliated healthcare is the healthcare center with a heart. Everybody has their own thoughts of how they want to be treated and how they do it. But what I find that's so amazing and so many times, chiropractic is the last try before surgery. It's amazing how many people have said to me, Doc, I didn't want surgery. My friend told me to come in here. I heard about you because your community work that you do. I met you socially. And I can't believe it. My pain is gone. I've had it sometimes short times, sometimes long times. But it's absolutely amazing how my body feels so much better and I'm not hurting. And I want to thank you. And that's why I've heard people say to me, my chiropractor's my God because he got rid of my pain. That's what's so great about being a chiropractor and what we can and we do. And it really helps to help you. Remember, my name is Dr. Barry Burak. Please share this with your friends, your family, on all your internet things so people can be aware of how we can help them. It's kind of interesting how we do it, how we help people, how we do things to help people. We do not use pills, no drugs, no shots. It's all hands, mechanical therapy, and different things that we do use. But so important for each and every one of us to remember. That's why it's so important for each of us to do exercise, because it helps to relax the body, helps the body to get into motion, it helps the body to use the muscles that it needs to use and not to create the problems it creates. Too many of us just sit there and do nothing. Myself, I average an hour and a half exercise a day. It's something that we need and have to do. And that's why I love helping people too, because I do my own exercise. Remember, my name is Dr. Barry Burak. I own affiliated healthcare centers. We have offices in South Miami, West Kendall, Homestead, Tavernier, Hallandale Beach Boulevard, and we're there to help you. We're open Monday to Friday, on Saturday at our main office in South Miami from 9 to 11. And we're there to help you. The office number, the main number is 305-666-8883. My cell 24/7, 305-389-9513. I want to wish everybody a great weekend. Relax, enjoy your time with you and your family.